no one else can hear you but the people that you would say, so it doesn't matter if you muted or not.
I could hear you, Mike.
You can hear me?
Yep. Hi, this is State Representative Brad Jacobson. Thank you for joining me on the teletown hall we're setting up to go over healthcare policy. If you have questions along the way, please push 0 on your phone. You'll go through to one of our screeners, and we'll try to answer your questions. With me is Rick Murdoch. He's the Executive Director for the Michigan Association of Health Plans. He's our resident expert tonight to try to answer any of your questions. How you doing, Rick?
Doing fine, Brad. Thanks for inviting me, and I'm looking forward to the conversation.
Well, thank you very much for being here. With the Affordable Care Act and then now the Healthy Michigan Plan, people have a lot of questions about how this is going to affect them and their individual policies. I'm much more familiar with the Healthy Michigan Plan, which is sort of the Medicaid expansion that we did in Michigan to try to help cover a lot of individuals who were in the lower income ranges that didn't have health policies.
And actually, the news on that has been very good for Michigan. I think contrary to the federal experience on the federal exchange, the enrollment process has worked very smoothly. The systems have worked. We have close to, I think, as of this point, right around 240,000 who have enrolled in the program for eligibility. That's as of today, and we expect most of those will be in health plans by the first of the month. So if they're not already enrolled, and we know they're receiving services because we get comments from physicians. There's an adult dental benefit, so we know where they're getting dental benefits. So, the program seems to be working well. We anticipated by the end of the year we'd have an average of 300,000 enrolled. So, we've got a ways to go to get to that average for the rest of the fiscal year, but things are going well.
I'd say you're on pretty good pace if you're in the over 200 at this point.
Right. So we're very, this is good.
Well, it's a wonderful program in that it helps provide care to those individuals. Let's talk for a minute, if you would, about what the qualifications are to get into that health care plan. If they didn't sign up for the ACA, the national plan,
sure,
they can get into the Michigan plan.
And actually they can go through the enrollment process for the insurance exchange, which is healthcare.gov, the website, and they will then refer you to Michigan and whether or not you're eligible for the expanded Medicaid program, Healthy Michigan, as we know it. But there are processes here in the state to go directly.
And just as a reminder, this is State Representative Brad Jacobson. For those of you who are joining in the call during process, we're with Rick Murdoch, who's with the Michigan Association of Healthcare Plans. If you have a question you'd like us to address, please press 0 on your phone, and that'll put you through to one of the screeners, and we'll try to get to your questions. So, Rick, I'm sorry I interrupted. You're talking about the qualifications to get into the Michigan plan.
Yeah, the qualifications are largely minimal compared to other programs. This is largely income-driven, your reported income, and it's largely for adults, working adults, if you will, because children are covered under Medicaid, My Child. So we're looking at up to 133% of poverty, and technically it's 138 because there's a 5% disregard. So they're looking at what your reported income is for the year, what percent of poverty that might represent, whether you're an individual or a family. And once that's determined, you're eligible. If not, then you're really eligible for the exchange, where they have insurance coverage and subsidies provided through that mechanism. But for Michigan, we have a individual website, and we'll certainly make it available throughout this conference call. It's www.michigan.gov/mybridges. There's a toll-free phone number, and that is 1-855-789-5610. Or you can visit your local Department of Human Services offices, wherever that might be in the various counties.
So when you make that phone call, or send it on the web, but if you make the phone call, that goes into the Human Services Department for the state of Michigan.
It will go into the eligibility program for Michigan, for the Healthy Michigan program, and they will walk you through the enrollment process.
Is there a limitation on the number of individuals that would be accepted into the Michigan plan with funding constraints and different things? Is there a cap on how many we can take in?
No. We have projections how many we expect to see, and what's budgeted for the year is, as we talked earlier, an average monthly enrollment of 315,000 for this fiscal year. And if we're up around 240,000 now, then we expect upwards by August, September, about 400,000.
And the Michigan plan's having a much better result and participation than the federal. It seems to be going fairly smooth from all indications.
Yeah, from the outset, it's been smooth. I will say that the federal website is working very smoothly now. That wasn't the case, obviously, last October and November. So,
okay, we've got a question from Judith in Oxford, who is wondering how is the greater amount of people on Medicaid helping those in poverty? I don't know that it's helping those in poverty with their financial situation, other than they would be getting medical coverages, that they would be able to still have their food and their rent and such, and wouldn't have to put such a high percentage of their income into any kind of medical program.
Yeah, exactly. And I think the research has shown that one of the largest causes of personal bankruptcy is healthcare costs, particularly for folks who are uninsured. Mm-hmm. You know, you run into a major episode in a hospital emergency room, you can't afford it. So providing healthcare coverage for low-income individuals actually prevents people from going through bankruptcy. Keeps them from avoiding other out-of-pocket expenses, and I think it does help lift folks up to other income strata.
And part of the idea with this plan also is to get those individuals with the Healthy Michigan plan. Maybe we should talk a little more about what's in the Healthy Michigan plan, because it really encourages people who don't have coverage to go out, see a physician with fairly soon. I think 60 days is what the request is. You go in, you've got your coverage, you see a doctor, and he's able to diagnose problems that you may have before they become catastrophic. Sure. So we're hoping this is going to be a preventative program and save some money so people don't have to go in for long-term or into emergency.
Yeah, exactly. The program is set up so within 60 days of enrollment into a health plan, each beneficiary enrollee is to have scheduled a visit with their primary care physician. And if you don't have one will be assigned to you. So we want to make sure that everyone has a primary care physician. And at that first initial visit under the Healthy Michigan program, there will be a health risk appraisal that will be done. And that will analyze the health needs of each individual. And then there will be a joint agreement between the individual and the provider in terms of a course of how you're going to take care of yourself. And there's incentives built in both for the beneficiary and for the provider to actually accomplish that. So we want to have more services through the primary care setting, less services in expensive settings, more preventive care. And this is set up to ultimately save the state dollars along the way.
Very good. Thank you for those who have called in and are listening in. Again, this is State Representative Brad Jacobson, along with Rick Murdoch from the Michigan Association of Healthcare Plans, talking telephone town hall today on healthcare policies and the Affordable Care Act, Healthy Michigan. If you have a question, press 0 anytime while we're on the air here, and we'll go to one of our screeners and we'll try to address your question. I'm very pleased to hear it's been as big a success thus far. Now, I have a question that was brought to me by a constituent, and they had gone in. This a woman's in her 60s.
Sure.
She lives with her elderly mother. The woman in the 60s has no income.
Mm-hmm.
She went to a federal program and went to Social Security office and tried to get Medicaid signed up. They told her she wasn't eligible because of her age. Didn't make any difference to them that there was zero income for her.
Mm-hmm.
And they rejected her. And she doesn't seem to remember, but all of a sudden she got some information from M.I. Bridges
Right.
and the Michigan plan.
Sure.
So if you get rejected by the federal plan for some reason, or does it kick over into the Michigan plan?
Yeah, I think what might have taken place in this instance, the Healthy Michigan program started April 1st, and there are a lot of individuals who went online or contacted the federal government because of the enrollment of the Affordable Care Act and the insurance exchange, contacted the federal government, were denied that they didn't meet the coverage requirements. And those people were on a list that was provided to the state for them to recontact once the enrollment in the Healthy Michigan program started.
Okay.
So I bet that's what occurred in that episode.
Well, she was quite surprised because she contacted me because she thought she didn't have coverage. And the more I spoke with her, and she said, well, I've got these two cards. One says plan number and one says Healthy Michigan on it. Yeah. I said, you're covered. Those are your cards.
Right. So it was just a delayed response because of the start date of Healthy Michigan.
The start date, but here again, the follow through that she didn't even, and she was in a queue, so it worked really well for her.
Yeah, we've been told, I haven't gone online myself, obviously, but we've been told that once you have all the information filled out, it's literally a decision is made within 3 to 5 seconds.
Really?
In terms of, okay, yes, you're eligible, you qualify, or no, you don't. So the state has really done, I think, a very super job in their development of the system for the approach.
Okay, very good. And, you know, when we passed this through the legislature late last summer, early fall, there was a tremendous amount of criticism that it really was an extension of the Affordable Care Act and Obamacare, as it's most generally known. And I looked at it really rather differently, that it was more of a good, sound business practice in that we were trying to get people to do preventative care, keep them out of the emergency rooms that cost astronomical amount. And then there's also a provision that after so many months, you need to start paying some co-pays, and it's sort of like a health savings account.
Right.
Can you explain how that works a little bit?
Well, we're very curious how it's going to work. You know, this is a new responsibility for my members, health plans who contract with the state to deliver this program. But they're charged with developing this report to every individual who's enrolled in the program, and it'll identify your personal cost obligations. If you're above 100% of poverty, there's certain requirements for co-pays and deductibles. If you're below 100%, it's different. But there's going to be a quarterly report to give you that information. It'll also provide information about the services you've already received, so you'll be aware of basically the cost of health care. It creates more awareness. And people, I think, are used to seeing something that's referred to as an explanation of benefit, an EOB type of report. Mm-hmm. This is probably what it'll look like, something like that. But it'll be distributed to everyone enrolled in the program, and it'll identify obligations, and hopefully it'll provide greater awareness of the cost of health care. And part of it is transparency. How much do these programs cost? And I know a lot of individuals want to pay their share. So this is a vehicle to provide that information up front so they'll know.
Very good. Thank you to those of you who are on the line. We've got another question from Sheila in Oxford. Should we continue the Affordable Care Act, and will Lansing continue to support it? It's really two different programs.
The Affordable Care Act, there is just a lot of components in there that people react to. I think the most notable and visible is the insurance exchange right now. But I think there's been a lot of other provisions that are very popular. There's provisions in the Accountable Care Act to extend coverage for children who can take coverage under their parents' policy.
Up to 26 years old.
There's provisions to eliminate the pre-existing conditions. So if you had an illness, whether it's cancer, heart disease, or some other chronic illness, in the past you might not have been eligible to secure individual policy, so you wouldn't leave your job or wouldn't take other opportunities that might be available to you because you're afraid you'd lose your health care. Now, under the Affordable Care Act, everyone is to provide health care coverage regardless of this pre-existing condition. So that's guaranteed issue, as we call it in insurance.
Healthy Michigan, when we introduced that, we actually had to, or when we proposed that, we had to get some waivers from the feds because we weren't following along the guidelines that they really expected us to with co-pays and some of the other things we had in ours. A lot of states, not a lot, but some states are simply expanding Medicaid to this new eligible population. What Michigan chose to do was to let's use this and try and interject the preventive nature, some cost-sharing principles, and basically have it apply not just to the Healthy Michigan program, but have it apply to the rest of the Medicaid program as well. So there are incentives that are in play that affect all of Medicaid, not just Healthy Michigan. There are incentives for the individuals, incentives for providers, and some of these cost-sharing provisions are in play. So this is called a demonstration project. It's a 3-year demonstration. We'll see if the waiver can be renewed based upon success. But part of the success is will be determined, how many people enroll, and what type of services do they get, and whether or not the providers are providing more preventive services along the way. And one of the provisions that was put into the Healthy Michigan plan when we pushed it through here in Michigan was that when the federal money goes away, the program's going to go away. We're going to try to do everything we can to get protect funding on that.
Sure. A point of clarification. When the federal dollars go away, the only way the state will continue the program is if we have generated savings from the first 3 years of the program and the rest of the Medicaid program and use that savings to continue the state spending for the program.
No savings coming from having people go to a clinic with their sore throat rather than to emergency and having the state have to pay part of that emergency cost.
And there's a formula actually that will come to the legislature from the state budget director actually in June or July, so you should be seeing it shortly, that will give a formula. How are we going to measure what savings is? We'll tell you how we're going to do it now, and then that's how we'll measure it 3 years from now. So that'll be in play, and everyone will know what the metrics will be. And then I imagine the incentives, the various contracts with my members will be developed to do it.
Yes, we've got another question. If you have questions, please press 0, and you'll talk to one of our screeners, and we'll get you on the screen and ask a question. We have a call from Marcia in Oxford. How does Michigan help those who are visually impaired, particularly those who are nearing retirement?
So the Healthy Michigan program, I think we can start there anyway. The Healthy Michigan program, if one is eligible for it, the vision services are part of the benefit package. Also is provided is what we refer to as non-emergency transportation. So, which means that if you have an appointment for services, you schedule an appointment, the health plan, our members, are then have arrangements with different transportation services to pick you up at your home or wherever and deliver you to that particular healthcare provider and then take you home. So, we try to make those arrangements ahead of time, so it's dealing with scheduled services rather than emergency. But so if folks are visually impaired, can't drive, are dependent on others for transportation, that is part of the benefit. Transportation, as well as the vision, whether it's eyeglasses or a visit to a ophthalmologist or person of that nature.
Okay, and dental covered with us also?
The Healthy Michigan program has added as a benefit adult dental services. And one of the reasons for that is there's been a lot of studies that have shown that emergency services for dental is costing anywhere between $60 to $80 million a year in the Medicaid program.
Wow.
So if we look at it for Healthy Michigan, if we can provide preventive dental care, then we can avoid and provide some cost savings. So it is a service that's provided now, largely through arrangements with Delta Dental, or in Southeast Michigan, there's a company called DenCap. Those are arrangements being made by our members with those dental network services, and you're treated simply like another dental patient at that point.
Mm-hmm. You mentioned at one point adult dental. Let's talk adults, kids. If dad goes in and signs up for this, is the family covered to 26 like they are through the ACA? Or how does each individual over 18 have to sign up themselves?
Right. The Healthy Michigan program is set up for adults, basically. And the reason for that is children up to age 18, are covered either through regular Medicaid or the My Child program, and My Child will take it up to, I believe, 200% of poverty. And regular Medicaid, Healthy Kids Medicaid, as they call it, goes up to 185% of poverty. So kids are covered basically up to 200% of poverty in one of those two programs. They have dental, they have a lot of the preventive services. So if the father, the mother, whatever, seeks to enroll in a program, hopefully they'll enroll in the same program the child is in. That just makes things easier. They don't have to. So it's out there and available.
Okay. Now, if you've got a question, please push 0 on your phone, and you'll speak with one of our screeners, and we'll get to your question. Drew blank.
We're going with kids.
Right.
Adolescents. I might say, the state of Michigan, through the Medicaid program, provides coverage for infants. Over half of all births are through children enrolled in for babies are Medicaid. As I said, children are covered up to 200% of poverty, and then they would be covered after that under the insurance exchange if someone bought a policy, a family policy.
Okay, let's just talk. That's where I was going. Let's talk about that conversion. So they sign up. Initially, they're on. Say they're unemployed. They have 0 income.
Sure.
Initially, they're on the Healthy Michigan setup. Then, after so many months, they may be moved or be able to move over to a traditional policy.
Sure. Yeah. And that's one of the I think wrinkles in Michigan compared to other states. And that is after a period of time, we're setting up these what we call HSA-like programs where individuals will have a payment responsibility. It's, I think, less than 2% of your income over a course of a year. And that's where that information comes from health plans to tell you how much that obligation will be. But based upon how much you pay over a course of a year or 2 years, if your income changes and you're no longer eligible for Healthy Kids or Healthy Michigan program because you're above 133%, you can take that residual income that may be left in that HSA account, if there is any, and that can be used as a voucher to help any payment within the insurance exchange. So you can enroll at that point into one of the insurance programs in the insurance exchange, receive subsidy because there are subsidies available. You still have some personal pay responsibility, but you can use that voucher from the Healthy Michigan program to cover those expenses.
Okay. We've got a question from Larry in Lake Orion. Is North Oakland Transportation Authority, NOTA, part of the transportation that is system that's reimbursed for people that need medical transportation? And if not, how does it become part of it? I don't believe they would be part of it at this point, but that's not to say they couldn't be. You mentioned that if they're covered under a plan and they need transportation arrangements are made, how do transportation services or a taxi or somebody get involved with that?
Great. Great question. And I have two answers to it, actually. One long-term, one short-term. The short-term, each of the health plans that contract with the state to provide services have to have a network of providers, whether it's dental, vision, or transportation. So they have that network. If you're enrolled in one of the plans, you would contact them to make arrangements with their transportation provider. We are working with the association representing all the transit authorities in the state to see whether or not we can't create some vehicle for all of them to be part of the network for all of our health plans statewide, because we believe this meets both their obligation as a transit authority as well as provides a worthwhile benefit for the insurance companies that provide these services. So we expect if in this case, the North Oakland Transportation Authority does not really have a relationship with any of our plans, we're very hopeful in the future they will through this effort we're underway.
Well, I appreciate that question from Larry. So I have contacts with Lynn, who's the director there. So we can get her information to the providers that you work with.
Sure.
And maybe get them on that list.
Short term, and then we're working with the statewide Transit Authority Association for a statewide program.
Very good. NOTA is a great program, and I'm glad Larry asked that. It should help out for them. We've got a call from Rich in Addison Township. Is Healthy Michigan another form or name for Medicaid? Again, excuse me for a second before you answer. If we have questions, please press 0 on your phone, and we'll get to your question. So, is it really another form of Medicaid?
You know, these are all labels, I guess, as we go through it. I think the thinking is that this is a new initiative for the state. We want to treat it as if it's different. But the reality is it's all part of Title 19. Title 19 is Medicaid, as the federal government knows it. So the federal government would refer to this as Medicaid. Everyone in the state of Michigan that's running the program is referring it as a Healthy Michigan program because we're trying to promote healthy behavior, preventive care, and services. And what happens with the Healthy Michigan program and the lessons learned then will augment back to the regular Medicaid program. So the short answer is yes, but that's not what we're labeling it. And I guess we just have to go with labels.
I guess the other thing that's really different here is this expands the program to cover those individuals up to 138% of poverty. So what we're trying to do is for those individuals who are struggling with their budgets at home, having trouble putting gas in their car or food on the table, trying to let them have health care, preventative health care really is the goal here, to get healthy, keep healthy, so they don't go to the emergency room and become a catastrophic case that would cost the state a lot of money or put them into bankruptcy.
Sure.
So it's I'm quite pleased with the idea, the way it seems to be working. We're having good sign up.
Yeah.
So we're looking for some more questions. If anybody's out there has something they'd like to check. Oh, very good. Michelle, thank you. Michelle from Orion asked, the kids have been getting dental care through Medicaid, but finding a provider has been tough. Is there a list of providers, and why aren't dentists providing this service more?
The short answer to that, the dental reimbursement to providers has been abysmally low historically.
The amount that they're paid
the amount
by
that
the insurance.
the state pays for dental care in the Medicaid program. When we launched the Healthy Kids Dental Program, it was launched through an agreement with I think largely through Delta Dental, and using their PPO network, and the state realized they had to kick up the reimbursement. So there's a substantial increase in reimbursement through the PPO network that Delta Dental uses, so which is a large network, quite honestly. What we've done with the Healthy Michigan program is using the same principle. If we're going to provide an adult dental benefit, let's make sure we have a provider network that can be available to provide that service. So for the health plans rates that are paid by the state, they included a bump or a rate increase, if you will, specific to adult dental services, and it's intended to create that reimbursement mechanism to facilitate this. If children are having the question, I think, was more specific to Healthy Kids Dental, and hopefully, if there's difficulty providing a dentist, you should either contact the state or contact the health plan in which the individual is enrolled in, and they should be able to help you provide or find a dentist that's taking services.
Certainly, and Michelle, if you're having trouble getting through to the health plan, or just running into a stone wall. I know sometimes it's terrible sitting on hold for an hour sometimes with these different agencies. Call our office. We will be happy to try to assist you however we can. You can call we have a number 1-855-REP-BRAD, 1-855-REP-BRAD, that goes into our office, and we'll help and try to facilitate yours or anybody else's problems with a whole variety of things. Quite often in the office, I feel like we're a reference library, directing people to various agencies or help cutting red tape, and that's what we're here for. So overall, pleased with the system and the way it's going now?
Yeah, I think so. I think the critical issues will be month 6, because that's when some of the additional systems kick into play. That's when this HSA-like reports are supposed to be first generated, and hopefully by then most of the folks who are the initial enrollees will have received their health risk appraisal that would have been provided to the physician office, and engagements already taken place in preventive care. We'll know all of that within the first 6 months, and I'm sure legislators who took some very hard votes on this, you and others, will be very interested in those reports.
All right, let's see. We've got another question here. It's coming in from Jay in Lake Orion. I'm 71 and on Medicare. My wife is 49 and uninsured. I'm having trouble with the username and password information signing her up for the Healthy Michigan plan. How do I sign up for a plan online? We've got a website you can go to, but it sounds like you're having problems, or there's a phone number. It's www.michigan.gov/MIBridges, or 1-855-789-5610. Again, it's 1-855-789-5610. And as I just mentioned, if we could be of a service in our office, please contact us. We're easy to find. Again, this is State Representative Brad Jacobson, and my guest with me is Rick Murdoch from Michigan Association of Healthcare Plans. If you've got a question, please tap on 0. We're here for about another 10 minutes, so we've got time for a few more questions. So what do you, with the username and password, you mentioned you hadn't been on the system. I haven't looked at it. As far as I'm aware, everything's working a whole lot better with the Michigan plan than the ACA.
Yeah, I think so, and I know, a lot of us have difficulty remembering usernames and IDs, so that may be part of the issue here in terms of accessing. But once you're on, it should be fairly clear. But I would advise, if you can't do it through an online mechanism, use the phone call, or if you have the opportunity to stop by your local human services offices, I think they're all set up to handle this for you as well.
Okay, we got a question from Don in Lake Orion. What reforms were put in the changes to Medicaid to ensure we protect Michigan taxpayers? Well, this plan was done largely as a combination of things to try to contain our state Medicaid expenses, because we had so many uninsured people going to emergency rooms, and it was hurting the state on that. So we're trying to do some savings there. And then also it's set up like a health savings plan, so you have to go in, get some preventative care. You have to, once you can get your feet under you, need to have some co-pays on some things.
Right. There's a couple other, I think, cost-saving attributes of the plan as well, and those are actually underway as we speak. One is there's been what we refer to as a cost-shifting phenomena that goes on. And what I mean by that is if you're uninsured and you need health care, whether in the emergency room or it's a delayed condition and you're all of a sudden hospitalized, you get the care because the providers are obligated to provide those services, but the cost of that care then becomes a burden to those who pay for health care, whether it's a small employer, a major employer, or it's a state government or a federal government. So by virtue of providing more health care services for those who are uninsured, which is what the Healthy Michigan program set up to do, we should reduce the amount of cost shifting that previously took place. And we're going through a very explicit process that's built into the Healthy Michigan program to analyze what was in the base year, which is the year we're in, what was the base year of reported uncompensated costs by Michigan hospitals. They have to report that annually. So what is that base year? And then what is the change from year to year? And that will give us an idea of how much the cost shifting has changed as a result of more people having insurance coverage. And then the second phase of that is, once we know that, then we'll also go to the insurance commissioner's office, and they're involved with it now, and they will analyze how much our insurance companies, commercial carriers, reducing their premiums or not increasing as much, reducing the rate of increase, I think would be the correct way of saying it, as a result of having fewer costs shifted to them as a result of this process. So that was one of the key issues that I know Representative Shirkey, as you well know, was a key proponent of that to build in. So that's in there, as well as the issue of the only way this succeeds in the future years is to demonstrate savings. So the pressure's on the state, the pressure's on the health plans who provide services to the state to demonstrate and show savings. And the savings are supposed to be not just to the Healthy Michigan program, but to the entire Medicaid program. So it's a challenge.
Right. And then we mentioned earlier in the call, I don't know if Don was on then, if the federal funds disappear, those savings that we've gained in Michigan could come back to continue the program for another year or two. And that's part of the idea, is we're going to save some money during the first 3 years with the federal money, and then after that we should have saved enough and have continued savings to provide care for those individuals who are struggling economically.
Right.
All right. Well, very good. We're getting low on time. We've still got a few folks that are out there hanging out. I appreciate everybody listening in today. If you've still got a question, we've got about another 5 minutes. Again, this is State Representative Brad Jacobson with Rick Murdoch from the Michigan Association of Healthcare Plans. We really didn't talk about your association too much.
Sure.
You've got a variety of different members, large carriers, small carriers, medium carriers.
Yeah. Yes, and yes. We're a trade association in Lansing that represents health insurance companies that provide either Medicaid services, Medicare services, or commercial services. They are large companies. Folks would know probably in your region, probably Health Alliance Plan, Health Plus, Michigan, Meridian Health Plan, Molina. Some of those organizations are in that side of the state. Priority Health is another one on the commercial side. PHP here locally, the Upper Peninsula Health Plan. If I don't identify them all, I'm sure I'm going to hear about it from my members. Our job is basically to represent them here in Lansing, work with you and your colleagues as we deal with both budget, regulation, through the Insurance Commissioner's Office, and to make the program as smooth as possible for our constituents and your constituents. And if we can do that together, I think it bodes well for a very cost-effective program.
Okay. Let's see if we got any more questions. Nope. I think we've run out of questions, and I think we're gonna sign off here. Again, thank you very much for those who asked questions and participated, and those of you listening in online. Again, this is State Representative Brad Jacobson. Thank you very much, and with me is Rick Murdoch from Association of Healthcare Plans. We got one more question just popped in here. We'll get to this one real quick. Last question from Lori in Oxford. Has HAP Healthcare and her co-pays on prescriptions are going up with her HAP program? Is there a reason they've increased? Does ACA Medicaid affect my plan to increase cost?
Let me try the second part of that question first. The issue of increased cost to you as an individual would be limited if it's Medicaid or a Healthy Michigan program, and there are limitations in terms of what individuals pay out of pocket. The waiver that Michigan received allowed for additional copay responsibilities, but at the end of the day, if you can't pay them, then there are waivers that one can go through, and we recognize those limitations. Regarding the HAP or any other organization that's dealing with prescriptions, there are a lot of increases going on in the whole pharmacy area. Specialty pharmacy products are one of the largest drivers in healthcare costs today.
So what do you mean by specialty products?
Specialty products are not your name brand drugs, not what you get at the drugstore, but these are products generally that are prescribed, and actually you receive them in a physician's office. They deal with either disease maintenance, cancer, kidney,
chemotherapy, dialysis, those types of things.
Right. Those, and as we have more and more people with those chronic conditions, those are drugs that cost anywhere between $80,000 to $100,000 a year. And we're seeing more and more products coming out in the specialty product area. We have one coming at us that will be a budget issue, and that's the Hep C pharmaceutical products. There's only a limited number of providers producing those vaccines or products, and we expect the initial cost on that Hep C would be somewhere probably between $70,000 and $100,000, and no one has really built that into their premiums and or the Medicaid budget if it comes on the Medicaid side. So what's happening is those costs are incurred, and the following year, subsequent year, they are factored into the premium. So I suspect that's why some individuals may be seeing increases in pharmacy overall. But there are other factors that may be at work too. And hopefully, to the degree that plans are being more creative in terms of using generics, if you can use generics, or preferred drugs on their formulary, that will reduce your cost as an individual.
Okay. Well, I want to mention something that always bugs me regarding those issues with health. Is I'm a big fan of local pharmacies.
Mm-hmm.
And so often now, I know if you have a long-term prescription and your insurance company may want you to order it by mail or go to one of their preferred pharmacies, I think a lot of times, in talking to the local corner pharmacist, they can take that coverage. It's just a matter of you telling your carrier, I don't want to go to big box store pharmacy. I want to go to the local guy.
Right.
So is that how do you resolve that? I mean, I understand there's cost savings for the insurance companies with that.
Right. I think it's a matter of these are regional issues. Clearly, once you get outstate Michigan, rural Michigan, the family or local pharmacist, that's really the only pharmacist in town. There's more opportunity, more providers in some of the urban areas, southeast Michigan. But you're absolutely correct. People have relationships with their local pharmacists. That's where you want them to go because you get a lot of education awareness, the contraindications that may be in play. And I know the issue of pharmacy networks is one that's really facing our industry, and we need to step up to the plate and look at how can we keep those folks on board and keep the costs low. So there may be some further negotiations that have to take place. But you raise a very key issue, and it's not one we haven't heard before.
Well, we have another question that popped up here right at the end as we're getting ready to close off. Carrie from Ortonville called, says, I've applied for Medicaid. I signed up for a Blue Cross plan and have already made my first premium payment. Now Medicaid says I might be denied coverage. Do I get my premium payment back?
Okay, so if the individual has applied for Medicaid, when you signed up for a Blue Cross plan, I don't know if the initial requests were for the insurance exchange and then you found out subsequently that you're eligible for Medicaid and then you enroll in Medicaid. If that's the case, you should get your premium back if you paid it under the assumption you were covered on the exchange. There shouldn't be any premium payment at all for Medicaid. So my only thinking here is that you initially applied for coverage under the insurance exchange, subsequently found out you're eligible for Medicaid, and now it's a matter of getting your premium back. You should be able to get your premium back, and I would very definitely work back through Blue Cross if this is who it is, and if not, then through the insurance commissioner's office.
All right, so Carrie, there you go. Follow back with whoever you sent the money to, and if you get stonewalled, give us it back. You should get it back. Give us a call at our office if you run into a stonewall on that, and we'll try to direct you to the right folks to resolve that. Well, we're going to sign off now. Again, this is State Representative Brad Jacobson. Thank you very much for listening in. Rick Murdoch, Michigan Association of Health Plans, thank you very much. Appreciate your expertise.
This was fun. Would like to do it again.
We may do that. We've done it on several other topics, and we may do another healthcare. Okay. So thank you very much to all those who participated. Have a great evening.